because funding these initiatives is becoming sort of more urgent than ever because of what is currently happening in the funding and development landscape, which is, Georgia said, sort of rapidly changing. So I thought for everyone else, and Joel we've discussed this ad nauseum, but I will give you just a sort of brief overview of this changing landscape and how it's kind of impacting our programs and some of the things we need to be thinking about going forward. So the current challenges, Bantwana was initially set up sort of about 15 years ago to build local capacity to really address the needs of vulnerable children and families affected by the HIV epidemic. And at that time, funding from large donors rarely went to local organizations, and we became an intermediary applying for government and other grants to support local partners and communities on the ground and building capacity to provide the really critical services needed by children and adolescents in high HIV prevalence countries. There's been a real sea change in global politics, and the decolonization of development. I know Kumkum hates that phrase, but really it's what's happening. In turn, is redirecting funding very much locally. Funding is going local. And although these changes in many ways bring full circle the original intention of Bantwana, which is what we'd always hoped, that Bantwana would be independent locally, it's also very challenging as we seek to adapt and carve out a relevant role for ourselves in this changing environment. So these funding shifts have been in process now for several years. There was first something called USAID Forward for a couple of years, where there was a sort of focus on taking localization through support with international organizations so they could become direct recipients of US government funding. And more recently, in May 2019, the US government launched something they called the New Partners Initiative, which has gained momentum across USAID and especially across PEPFAR, which is the President's Emergency Plan for AIDS, and which is from where we get most of our large funding. And they have been setting the goal of 70% of PEPFAR funding going directly to local organizations and new partners over the next 2 years. So broadly, what does that mean? What does localization mean for us? This is happening at 2 levels. Funding is going directly to local NGOs and locally established partners and bypassing international NGOs. And government-to-government funding is also on the increase, which means funding goes directly from the donor to a government ministry, who then decides on the technical assistance they need and whom they contract for the work they need to be done. And that's always been the World Bank model that doesn't support organizations like ours directly, but puts money in governments, and then governments decide who they would like to help them with technical assistance. But other donors like USAID, DFID, and Gates too are going much more in this direction. So we have started to position ourselves and apply for these kind of technical assistance grants, and we have just won our second one in Zambia, where the World Bank is supporting the Ministry of General Education. And we are helping them roll out case management to retain girls in school in Zambia. But our contract is actually with the government of Zambia. We are directly contracted by the government of Zambia. And we have just put in another proposal a week ago to do a similar contract with World Bank funding with the government of Zambia to prevent gender-based violence in schools, school-related gender-based violence. And they call these technical assistance grants sort of consultancies, but they are 2 to 3 year consultancy. So we're about to open a small office in Zambia to kick off the case management consultancy, quote unquote, and pilot the case management framework we've developed in 3 districts in Zambia. And we are hoping that if we are lucky enough to win the school-related gender-based violence consultancy, we'll be able to grow our position and our work in Zambia. So that gives you just an example of that. But this direct funding approach is also affecting our more recent large USAID anchor programs. So, you know, we've had large programs in Mozambique, in Uganda, now in Malawi, and we rely on these large programs to keep us operating. So with the shift, we may be awarded a large grant, but we're now contracted as part of our grant to hand over direct project implementation to local project partners after 2 or 3 years. And we take on a much smaller capacity development role supporting these local partners. So Brian, if you could just put up that one slide that we developed yesterday, and I'll just be able to walk you through it, just give you a snapshot of where Bantwana is. If you could share your screen. Brian made a very smart black and orange slide for us. So if you take a look, different countries are, you know, really taking slightly different approaches and different timelines, but they're all on this trajectory, this new partner initiative trajectory of going local. So in Malawi, we are the prime in a new large OVC program, which we were lucky enough to win last year, 2020. It's a 5-year program, but we are leading it and implementing it as a prime only for the first 3 years. And after 3 years, we are going to hand it over to the local partners whose capacity we have built in the first 3 years, and they will lead this project for the last 2 years of the program, and we will have a small capacity development role. In Uganda, we have been a prime on a large $40 million project for 5 years, which recently closed out. And now we are consortium partner on the follow-on grant, which started also last year in 2020, which is both for OVC and education. And in fact, Anne's sister Susan is leading our program there because we are leading the OVC piece of this project. But like Malawi, we have been contracted to transition the project to locals after only 2 years of implementation. So by year 3, and then for the last 3 years, we will be playing a capacity development role. In Mozambique, we were a prime on a $26 million project that ended in December 2020. And unlike Malawi and Uganda, USAID has immediately awarded the follow-on program directly to local partners. So, and allowing just a limited technical assistance role for an international organization. So we provide technical assistance now to 2 local prime partners who were selected to implement the program in Mozambique. And so across all these programs, Malawi, Uganda, Mozambique, we are working with 15 local partners to become direct recipients of USAID funding now and continue the work themselves. And then finally, in Zimbabwe, we have localized Zimbabwe and as Bantwana Zimbabwe, and as a local NGO, they have been successful in winning several projects, which have come out exclusively for local organizations. And I'll talk a little bit more about that in just a second. And they are also offering technical assistance support now to 9 partners in 7 countries around our Siaka Girls model, which is a girls entrepreneurship model that has been sort of tapped by USAID and PEPFAR as an evidence-based model to really help girls with work readiness and to find employment. And so we have other organizations now coming to us to help train them in how to set up and roll out this model. And we know that there are new projects coming out in both Tanzania and Mozambique, totally exclusively for locals, and we're already positioning to get behind local for those upcoming projects. So thanks, Brian, you can take that down now. So in terms of sort of positioning ourselves for these changes, we have localized in 2 countries, as most of you know. We are Bantwana Zimbabwe and we are Bantwana Eswatini in both Zim and Eswatini. And we've spun off Bantwana affiliates or locally established partners using a franchise model whereby we, World Ed Bantwana, continue to provide technical assistance and capacity development support to our local partners, to our local Bantwana Zimbabwe, Bantwana Eswatini. And so more and more of these grants are being released for local NGOs like our affiliates across Africa. So currently, as an example, in Zimbabwe, we are a local partner for a large CDC grant, a $12 million grant. And Bantwana is also bidding on a $70 million USAID Dreams grant that's just been released from PEPFAR, and we're part of a local consortium for that. So if we're successful, we'd be eligible, I guess, for, when I say we, our local affiliate, not ourselves, for about $10 million over 5 years. And we will have a small role and to continue to support them with some financial and technical assistance help. We will continue to explore options for localizing in other countries, but as you can imagine, some countries are riskier than others, and we have put in place several criteria to be met before we are willing to localize. We're also experimenting with a consulting approach, just like I mentioned, with SIACA. So, this is something we can think about adapting for other types of training or TA, and it's a way to reap some income, spread the model, get the word out about other things Bantwana is doing. And the fact that Bantwana Zimbabwe is doing it in a very entrepreneurial way is great. And we're fully behind them and helping them roll out this consulting model. We're also positioning for government-to-government TA, but along the lines of the World Bank example I gave you. And we're currently working with Kumkum, actually, to develop a case study for a position paper on our work with national governments to help roll out and scale innovations sustainably as a technical partner to government. So one of the hallmarks of Bantwana's work has been the capacity development work we do with national ministries at the highest level to take a viable model for a specific sector to improve quality of services and help scale that model and roll it out nationally. So coming out of our last board meeting, we talked about capacity development. I think you guys may have remembered Kumkum talking a bit about the Reimagining Technical Assistance Committee she sits on, and about the funding landscape and how it's changing. And so I was just going to ask you, Kumkum, if you could give us some highlights, a couple of highlights of what has come out of your role on this committee and how you think we at Bantwana can position ourselves to provide this kind of technical assistance.
Sure, Joel. Joe, sorry. Joel.
Thank you, Joe, Jill. Lots of lots of J's and G's.
Okay. So building on the last board meeting where, when we were talking about how do we position Bantwana, and I mentioned the work that I was right in the middle of at that time, working on a project that was through the Child Health Task Force, which GSI is running the secretariat of. That comprises 3 large donors, the Gates Foundation, USAID, and the World Bank. And these three donors sort of came together in recognition of the fact that the landscape changing. What they were trying to solve for is based on a recognition that there's limited money for technical assistance going forward, particularly in the area of health system strengthening. That they themselves are responsible for a lot of the fragmentation and in some cases duplication of the efforts that are happening in the country, and that their collaboration is ad hoc and there's no formalized structure for collaborating between institutions. Also recognizing that governments are getting very savvy, not across the board, but many countries, particularly, Rwanda is always cited as an example. Burkina Faso, South Africa has been, also trying to get the donors to sort of sit around the table, and there's been a lot of reluctance on their part. So the question for them was, how do we, sort of come together in a more deliberate way to sort of engage with governments, recognizing that the answers are known. It isn't as though countries don't know what their needs are. How do the donors engage with each other and with the governments in a more meaningful way? So one of the the first phase of this effort was speaking directly with the federal government in Nigeria, as well as in the DRC, and those two countries were picked because of convenience. There were already connections, there was an interest on their part, and so these conversations started. And they came up with these what they call the 9 critical shifts.
You've muted yourself, Kumkum. Just unmute yourself.
At which point did I mute myself?
And nine critical shifts.
The 9 critical shifts, right? So as we were looking at these shifts, where these two countries were essentially saying, move from being donor-driven to being country-driven and country-owned. Stop creating dependencies. Recognize our sovereignty. And so there were 9 different things. And as I was working with those 9 shifts, and then engaging with these 3 donors as to how they wish to deal with these shifts, because the reality is there's a trust issue, that they themselves, there's a level of lip service that's being paid to government realities and country realities, and sort of really trying to understand whether, are they ready to go beyond the lip service? Is there really a lack of cynicism? Is there a recognition that the way business is being conducted has to change? And while we know that there's this buzz around, the shift in donor thinking, what we recognized, not just from the highest levels within these organizations, but those who are project managers and people who are seeing things on the ground, at the country level, at the project level, working with the implementing partners, that the donors themselves were the impediments, and that they needed to do things differently if anything was going to change. And if they want, and given that they have limited funding, they need to leverage on each other's technical expertise and help governments to think and reshape how they engage. So with all of that in mind, when we had our conversation at the last board meeting, and I raised the issue of, there's been all this great work that Bantwana has been doing at the grassroots level. How do we sort of pull that up and talk about it more holistically? So it's not, this is what we did in this community, in this country, and on this day, but what is our thinking collectively, broadly? How do we package this? How do we make it known that you don't have to keep reinventing, and giving countries the language that they can use in their conversations with donors, because there's a readiness on the donor side. So how do we, in the work that we're doing through Bantwana, how do we prep these countries to be able to tell a story more holistically? So we talked about 3 different areas, the HIV prevention in schools, case management, non-formal education, and there are a whole host of countries, 7 countries in which we're working. We can't tell the story in real time across all of these, different multifactorial, combinations. Let's pick one country, let's pick one issue. And so Zimbabwe and case management is what we said we would do. How do we package that story, taking a 10-year perspective? We have the advantage of having data. Everybody is interested in measurement. How do we know that change has taken place? Well, how do we put our work on a timeline and sort of point out? So really being able to take the Zimbabwe experience and pulling out some universal lessons, that can be promoted, and not only for ourselves, but also for the larger, sort of donor community, that for them to understand how technical assistance has been shaped, but in partnership with governments, and sort of helping to develop some kind of a roadmap that we can then, sort of build upon in the countries that we work in, but also across. So I'll stop here if there are questions, because I feel like I was a little bit all over the map, but just to give some context, and then how we started this this idea, and then the shape that we are planning to take this in going forward.
I don't know if anyone has questions, but we've just started working on this effort.
Hi, Jill. Can I just kick off? Maybe just to clarify, Kumkum. So the the pain point you were talking about was really how does a donor community come together in order to collaborate effectively and engage government?
So go ahead.
Yeah. So just listening to your brief description of Zim and case management as, I guess, an example of what Bantwana has done, then would you be sharing that example with governments to help them bring the donor community together, or would the donor community say, if you pull together, this is what you can achieve? I wasn't too clear of the target or the direction you were going.
Yeah, so my apologies, Anne. I mean, what I was trying to say is that the donors are recognizing the need to come together, that they themselves often, are the limiting factors, that they're not listening to governments, and they are certainly not leveraging on each other's capabilities and the work that's already happening in the country. There's a tendency to duplicate the work. Projects are set up often by the same donor, who are not able to work together. So two projects in the same country are not able to leverage each other's, learnings. So that they themselves are the impediment, to growth. So that's one piece of it. That's sort of on one track. And then it's a matter of how do we, as Bantwana, having learned many lessons, having worked closely with governments, having essentially looked at those 9 critical shifts and, sort of go through it and say, well, that's exactly how we do business at, in Bantwana. It is country driven. We do build sovereignty. We do, start with the place of trust. We do hold, countries accountable and our partners accountable, and so on and so forth. So how do we package it in a way that gives some a very clear understanding and support to the governments that we work with, to say, this is how we do case management. And if you want to participate in case management, well, this is the model that we want you to help shape and develop. So it's giving ammunition to governments to be able to engage in meaningful conversations with donors. So it's not just donors saying, well, tell us what you want, and everybody going, well, we want this, we want that, we want the other. But if we want case management, this is how you do it. This is how we've succeeded. This is what it should look like. So that's what I meant. And sorry if I went off on a few side jags.
No, that's good. Fred.
Is this self-undertaken by us, or is this a funded exercise by one of the donors or the government, or how's this kind of evolved? What's the genesis of this, and where, if we're sitting here a year from now, what would you like to see come out of this?
Julie, want to take it, or
No,
do you want?
Well, you could also come, but I think so. This actually, Fred, we are funding this ourselves. I mean, it's more like a documentation exercise, right?
Okay.
And it's really doing a series of focus group interviews with the donors we worked with in Zimbabwe, with the staff who were involved in building out case management. I mean, the whole, as Kumkum was describing the sort of 9-step process that has come out of the committee she's sitting on, it was like an aha moment for us. It's like, that's exactly what we do. That's exactly what we've done. And we now have a sort of really, the case management story is a success story in the sense that, we piloted this model, sort of joined at the hip with the Zimbabwean government, with the Department of Social Development, with the Ministry of Health.
Yeah.
And tested the pilot, expanded it to several districts, tested it again, and then worked on the whole framework of what case management should look like and what was driving that whole thing. I mean, I don't want to go into too much detail. It was 2008, the country had collapsed. There was one social worker for every, 40,000 people or something. There were no services in the rural areas. So it was really sort of brainstorming with the department. How do we get services out there? How do we build a community cadre that is skilled enough to do referrals and get people the critical services they need? How do we link them to education? How do we link them to health? How do we link them to HIV services? And what do we need to put in place to do that? And then working with the ministry as well to say, you actually don't have enough money to do this. You may have this great idea, but what you have to do is lobby the Ministry of Finance, because if you have a well-functioning social service sector out there, it's going to be much better for the country. So you're going to have to lobby the Ministry of Finance. And so we help them craft some of those advocacy messages and for their meetings with the Ministry of Finance. And they got money. They actually did get the money, and they were able to build out this community cadre, which are the case care workers that are fanned out across 65 districts in Zimbabwe now. Wow. So, it's a story we haven't really told. I mean, we talk about, how we rolled out case management at scale in Zimbabwe, but the actual process is really interesting if you break it down. And to Kumkum's other point, when she's talking about how donors often, cross each other because everyone has their own stake in the ground in these countries, and they constantly duplicate efforts, and then they have sort of rules and regs or strictures around what you can spend their money on, what you can't spend their money on. Well, in this particular instance, we were fortunate because we had, we were working together with UNICEF on one aspect of supporting government with case management. And we were also had USAID funding that was wanting us to roll out and test a case management model in our project. So we then got these two donors around the table, and we could actually leverage off both of them to actually build out both the sort of policy side, the framework side, and then the actual implementation. So does that answer your question? So again, the second half of your question is, what do we want to do with this? And we were just thinking, in this new, brave new world where we are, where localization is happening at all these different levels, we need to try and position ourselves to say we can be useful to you in a way, building on the experience we've already had. And so this would be like a position paper or some kind of, I think that's what we're thinking about. Get it on our websites, get to the table where people are talking about this stuff, present perhaps at, the committee Kumkum's working on.
Yeah, and give language to the governments to be able to tell the story, so that they can be in the driver's seat when negotiating with donors in this area. Yeah,
I mean, I think this is where World Ed is, as we've talked about before, has really sort of a unique competitive advantage because of the institutional experience. There are a lot of NGOs that have talked about doing this, but they really haven't done it. And I think that's where it's where the rubber meets the road. And as you know, capacity building is it's a long-term sustained enterprise. It's not a hit and miss thing. You just come and go. And I think obviously the donors should have been onto this years ago, but never, better late than never. But I think there are just very few institutions. I foresee a possibility of a real disaster 3 to 5 years down the road when all of a sudden they realize the capacity is not there to be shoving all this money, and they've grossly overdone the absorptive capacity of a lot of these institutions. And that's going to be a significant problem. And I think that's why I think these kind of steps, getting in front of that wave is a positioning World Ed and Bantwana, there are just very few organizations that from the ground up know how to do this kind of stuff. And I'm just saying, I'm congratulating. I think it's a smart move you've made to start documenting, because evidence-based stuff, you can never beat it, that's the key thing.
And Tom wants to say something, but just to sort of close this, Fred, I think one of the advantages that we have at Bantwana is to be able to look back at what we did. We have 10 years worth of data, and understanding in Zimbabwe. The donors keep hopping on measurement. How do we know? How do you know? And given the time frame of a lot of the projects, which are arbitrary, 3 years, 5 years, whatever they might be, incrementalizing their way into a longer term relationship. But here we're taking a retrospective look, and at different points in time, things that happened, that shifted, that enabled us to be able to make that connection. So we know that there's been forward movement, and sometimes there's been sort of sideways movement that then led to that forward movement and bringing other donors at the table. So I think those are the kinds of things that we want to be able to document, because we're not going forward in this, we're looking back and putting some meat around that growth and the achievement. Sorry.
So just to your point, Fred, and I know Joe wants to say something, and Tom too, but it's because the whole, World Ed has always been in it for the long haul. I mean, we have been developing and working on case management in Zimbabwe for over 10 years now, more like 12 years. We are still working with the Department of Social Development to hone some of the aspects of the case management model. We're working to help them now digitize their data collection system. We're also working around the areas of gender-based violence and HIV, training case care workers to really understand these other issues that have become much more critical. So there's always work to be done, but this has been an ongoing relationship pretty much, for 12 years now.
Jill, so Fred makes if I could hear him over his pet birds there. I think, there's a fundamental shift, as you said, but if I were to put my business hat on, one of the concerns that I have is the business models that each of these NGOs are undertaking. I mean, organizations in the United States, nonprofits in the United States are typically fragile. You can imagine how fragile they are in many other countries, not because they don't have talented people, but because the way business is done, because they're dependent, no matter what you think, on the next grant, and they have no resilience. I mean, World Ed and JSI have resilience because we've been around a long time and have a little bit of money in the bank. But you can imagine what will happen. So in many cases, this is good theory overriding reality. And I think there's going to be a lot of problems with it because these organizations, as I said, as good as they can be, if you don't have the scale, you start to give this kind of money to organizations without that kind of capacity, you could kill them. You could kill a really good organization for doing it. The other thing is that donors, especially like the United States, have a lot of accountability embedded in it. And the accountability, as you know, Fred, if you ever looked at the World Ed and JSI accounting systems, no private sector organization would have as complicated an accounting system, and we're audited, et cetera. Now you can imagine, how is that possible for someone in Eswatini or someplace to have that kind of capacity? It isn't going to be there. And at some point, someone's going to say, well, we gave all this money and we're holding the American organizations to all this compliance, and we're not holding the local organizations. I think you can think of a pushback on this. So I think it's important that it goes forward, but I think one has to have a business lens to it to say this makes sense and this doesn't make sense, even if theoretically it makes sense. And you know, there are many countries you can do it, in many countries it will be very hard.
Exactly.
Yeah.
And look, I mean, we're looking, as Kumkum knows, I mean, we're working in Ethiopia. Well, what happened? Well, now you have a huge civil war coming. I mean, so you have all these things happening, and unless you have a lot of resilience, it's really hard.
Yeah,
No,
and
I
Joel, if
agree.
I might say, you know, I think it's definitely, you know, it's not a one size across all countries, nor is it across all NGOs, nor is it across all governments. I think we certainly know in Zimbabwe, there is FACT, which is a very successful organization. There are some ingredients that some of these organizations that have succeeded, you know, in a country like Zimbabwe, when you come out at the other end of your economic crisis and your board has been with you through that process, you know, that you're there to stay. And those two other partners that we work with, Mavambo and Haspas, are very similarly placed. These are organizations, you know, that you could point to and say they will succeed, and they have managed many different donor sort of streams of funding, and they have systems in place. What they need to be thinking about is when projects come and go, the whole, you know, sort of the team doesn't collapse. So how do they think, you know, sort of cross teams, so that there's learning? If you're working on UNICEF, you're also working on USAID funding, so that learning is cross-organizational. So, you know, we were helping them on the margins as opposed to helping them with the bread and butter of what they needed to do. So there are institutions like that, and there will be others who will, you know, sort of fold up, you know, when the funding ends and don't have the resilience. There are also governments that know how to negotiate and know how to get, you know, donors at the table. Rwanda will not allow any donor to just show up and do whatever they please, you know, and will tell World Bank, you know, don't get involved in health, help us with infrastructure. Burkina Faso is looking to Rwanda. They're not looking to us. Ethiopia is modeled, you know, after Rwanda, and Gates has sort of said, forget about all these multiple different projects coming through the system here, just with Gates. It's going to go through the country director of Gates, and they're going to be, you know, the voice that has the access to the government counterparts to be able to sort of really listen and understand what their focus is and what their priorities are, and then feed it back to the foundation, and also work with other donors. And that's how USAID jumped on the HIS, you know, sort of support to Ethiopia. So I think it's not we can't allow it, you know, because it doesn't work in many countries. I don't think we can sort of say, therefore it's not, and I don't think that's what you're saying, but I think we just have to keep an open mind. Where has it worked, and how can we ensure that those countries and those governments and those NGOs can, you know, sort of continue to build on their successes?
Yeah, no, I mean, definitely there's successes, and you know, my concern, and Fred ran one of the most important ones early on, KREP, which you know, has sustained itself. No, there are those, but my concern is with the donors over-promising and then finding out that there's a, you know, it's like a venture capitalist, you know, 3 out of 10 succeed, 7 out of 10 don't. I just don't want to have to overpromise and then the donors throw up their hands, when in fact, if you did 3 out of 10 in your venture capitalist, you're doing fine. So, I mean, it's just the business side of it that I think sometimes gets lost in some of the ideology, which, as I said, I mean, JSI has a full India office, full Zimbabwe office, full Kenya office. I mean, so I believe in it. I just want to make sure that there's a realistic understanding of how hard this is, and not to get discouraged when there's a failure rate, which there will be. So
There will be.
Yeah. And I really hear you, Joel, because as we've actually localized in these two countries, it hasn't been easy. I mean, you know, you're up against all of these sort of business issues as to how do they sustain themselves, and once they're completely locally incorporated, there's a wall between them and us, and you know, they don't have the resources that they need. If they're just a lot of things that we are learning along the way about how challenging it is.
Tom has been very patient.
Tom.
No, first of all, thank you, and I'm respectful that the tenor of the conversation is based on facts and experiences that I'm not going to bring forward. But I had a couple of observations I wanted to share. The first is that in my experience, for-profit organizations work really, really hard to establish control over their destiny. Leaders like Jamie Dimon, would evidence that. Leaders like Jeff Bezos would evidence that, and I'm sure the Ambani family in India would evidence that, and so on and so forth. What I observe, knowing what I know about Bantwana and other nonprofits, is that you cannot control your destiny. You're working in the space between the most vulnerable communities in the world and fickle funders, and so trying to establish and maintain control is, in my opinion, a bit of a fool's errand. The second observation I make is that my knowledge and understanding of Bantwana's history begins, for me, understanding at the grassroots level the challenges of community-based organizations, and reading the thoughtful piece that Jeff Foster wrote about bottlenecks and drip feeds. And I think about the intention that Bantwana had then and the intention that Bantwana might have today. And if children are still at the center of that intention, I think we need to be really, really thoughtful to understand where are our strengths. And again, perhaps without basis, I think the strength of Bantwana is the network that over the last 15 plus years it has built. The evidence of its capacity to create and build partnerships, both across the field, within the field, and ultimately between Boston and sub-Saharan Africa. And each of those partnerships is a unique story which has unique learning to it. And then my final point is that just as Jeff Foster wrote a piece at a pivotal time when PEPFAR money was being 100% allocated to adults and people like Bantwana were scraping to get 10% of it, it sounds to me like we're at another critical time. There's another inflection point here, and respectful that I don't know the answer to these questions, will the quantum of aid itself be sustained? Certainly not in the United Kingdom, probably not in the United States, even under Joe Biden. We're clearly seeing evidence that the terms of that aid is changing. So my sense, going now finally to close with a question that I heard a second ago, could we get a grant to study, what does it mean to have done Eswatini, localization, Zimbabwe localization? What did we learn from that? And what might we learn from extending that, confederation strategy into Bantwana that would serve as useful information, apologies Kumkum, for the decolonization of international aid? It's here. And it's not something that we need to think about, is it coming? It's here. And all the points taken about how it will or won't work out. I just think getting in front of this, just as Bantwana did 15, 20 years ago, is exactly what is appropriate to think about now. So again, just thoughts.
Thanks, Tom. No, that you all good points, honestly. Could we get a grant to look at localization? I'm not sure, but could we get ourselves in a position where we can position ourselves with some of these approaches? I think that we probably can do. And I think we should.
If I can just jump in to build on what Tom's saying about the localization and documenting it. It could be something like a case study, like a business study, which has been done on many nonprofits and maybe even JSI. But that could be a sort of pedagogical tool for others in the field.
And I think, Tanya, that's
different from what we're talking about, Jill, in terms of doing, or is it more or different? Jill?
Are you asking me?
Yeah, well, the case study, because,
I think the case study, I think that's sort of what we have in mind, actually, right. Tanya, exactly that, is to write a case study about certainly our sort of government to government relationship and how we've built that sort of capacity. I think what Tom was talking about was more like actually localizing to our, our local affiliates and is that right, Tom? And how we've set up this franchise model of our local partners that are sort of, still joined to us here, but essentially they're independently and locally incorporated.
I think so. I mean, I honestly don't, I haven't thought it through to that level of
Oops.
Tell. I respect language like, you know, case referral network are of how Bantwana is the trust and confidence between different teams of people with a shared purpose, nurturing, cultivating, and supporting that, whether it be within Uganda, you know, across the different, you know, systems that one faces in Uganda, however many years ago, you know, bridging between the politic of the United States Congress and USAID and CBOs that are working in Eswatini. I mean, it's those strengths that are the essence, I think, of Bantwana. And so you know, what I'm feeling is that there's a shift, and being in front of that shift with a well-articulated, you know, evidence-based story is a powerful thing to have in a shift.
Mm-hmm. Mm-hmm.
And you know, Tom, just to go, sorry, Joe, were you going to say something more?
No. I was going to start moving us on, but just finish off, Kumkum.
No, I was just going to say that, you know, I mean, you gave the example of Diamond and Bezos, and, you know, those are fine for today, but there are many businesses that have gone out of business, you know, and if you take a, you know, 100-year retrospective, you know, those that were, you know, sort of on the ascendancy or, you know, well established may not be still in existence. So every industry has its own, you know, sort of vagaries and, you know, response when they're not controlling their destiny, even though they might think they are. Yeah. I think what I found noteworthy when I joined this business was how few businesses go out of business. You know, for the most part, if there's a commitment to an organization, the money keeps getting pumped in, you know, whether you're showing results or you're not showing results. And if that mentality then gets shifted from supporting US-based implementing partners to locally based implementing partners, that mentality will continue. They will keep pumping money. In fact, they should allow businesses to go under, and they don't. So, you know, it's a different equation. Yeah.
No, point taken, and I think I agree with that, Kumkum. Anyway, I think we should move on, but this was interesting and really interesting thoughts from everybody. And, you know, although the changes in our funding landscape do sound draconian, we do need to remember that we have 2 or 3 years of solid funding to sustain us as we try and figure out how we get ourselves in front of this wave. It's not like we have to do this by tomorrow. We have to start thinking ahead so that in 2-3 years' time, we have some of these other, hopefully, opportunities in place. And so how do we address these changes proactively? You know, what are some of the other business models we may be able to explore? How do we best position ourselves ahead of this localization curve and carve out a relevant role for ourselves, you know, going forward? And to stay viable, actually, I do believe we're going to have to rely more on, you know, a plethora of foundation grants, corporate social responsibility, other consulting, other kinds of money. We may have to have a lot more programs, but they're going to have to be spread across a much broader array of donors and supporters than now, where we have our large anchor grants that won't be playing that role quite as effectively going forward, perhaps. But moving into part 2 of our meeting, we just wanted to talk a little bit, and I'm going to turn it over to Eliza in a minute, is just, you know, what has happened during COVID and how COVID has dramatically accelerated the use of technology in our work across various sectors. So we've been really forced to figure out ways to use digital technology to support remote learning, for training, for support supervision. We're working in, you know, often very kind of low tech countries or no tech contexts. So how do we actually find a way of blended learning, or figure out what we've had to figure out what we can do effectively and what we can't, pretty much like building the plane while flying it, actually. Some of these approaches also, on a positive note, you know, we have uncovered some unexpected efficiencies by using mobile technology that can be carried forward, hopefully post-COVID, and could lead to increased access and increased equity. And, you know, how do we build on those, but also make sure that, you know, our the communities we work with are still getting the full impact of the services we provide and the interventions we offer. So just for example, you know, we have a closed user group that we have set up in Uganda among our case care workers, that, you know, the social workers, the case care workers at the community level are on WhatsApp with each other. It's a way to improve referrals. It's a way for them to consult on ongoing cases. We got support from MTN for airtime and for actual phones. And this is a very simple way that we've been able to keep people in contact. In Zimbabwe, we've been working with the EdTech Center at World Ed, where we've developed a kind of blended learning approach to train and support case care workers in Zimbabwe to address all of the increased levels of gender-based violence that have come up during COVID in very remote districts in Zimbabwe. And again, we're using mobile phones, tablets, but really the EdTech Center has helped us with sort of instructional design. What pieces need to be done in person? How do we do peer learning? What kind of machinery do we need? What is out there? And we're just starting to pilot that now, and they've been extremely helpful in rolling that out. So our job now is really to test how viable these digital program components are. And actually, we are planning a case study later this year on the impact of digital learning in Tanzania on teachers and on the girls we serve. And at the same time as we are integrating digital technology into our programming, the donor community is recognizing it's important and directing a fair amount of resources there. And so Eliza is going to talk for 2 minutes just about the research in this area and where the gaps still are.
Thanks, Jill. So that was a great intro. So over the last 9 months or so, I've been focusing a significant amount of my time on looking at potential funding for the use of digital technology, not just for Bantwana, but across all of the divisions at World Ed. So for Ann and Jing, who may or may not know, World Education has 4 different divisions. We have the domestic United States division, we have the Asia division, the Africa division, and then Bantwana, which is a special division. So I've been looking at what are the EdTech funding opportunities for all 4 of those divisions and all of the regions that they work. And I'll say that all the divisions were already starting to embrace digital technology in pockets across the organization before COVID, but COVID has really accelerated its use for everybody and also our reliance on it. As Jill mentioned, she mentioned the EdTech Center, which is a center at World Education, which has been housed traditionally in the US division, but now it's looking to expand globally, and it's really coordinating a lot of this EdTech/digital efforts across the division so that we can connect with one another, share what lessons have been learned, share funding opportunities, possibly collaborate together for funding opportunities. And as the EdTech Center is really seeking to professionalize, it's actually launching an advisory board modeled after Bantwana's, and a shout out to Jing, who is joining that board as a member. And it's great actually to have Jing here today because she is kind of an EdTech expert from the investment side, but also, as she mentioned, launching her own schools that integrate technology into what they're doing on a daily basis. So as part of this kind of work that I've been doing, I have been mapping the funding space for EdTech and digital technologies just to see what are the opportunities and how can we possibly take advantage of them. And so you'll see there's like a big increase in funding in the space, not always matched to where we need the funding, but there is an increase in funding, especially from the larger donors. But there's also a huge increase in EdTech accelerators and incubators, EdTech funding from angel investors and venture capitalists. So the space is really hot. And I'm actually going to have Brian flash one slide on for us. And I'm going to see if I can actually see the slide at the same time as I see my own things. Basically, I have a much longer presentation if anyone wants to hear it sometime and go into this really in depth, but just you guys get just one slide for today, which is just looking at where I identify the EdTech funding was. And so the current funding focus that I found is on the left side, and where we actually need the funding for Bantwana specific work is on the right side. And you'll see there's a bit of a disconnect. So there's a lot of funding I found for workforce development, getting adults, reskilling them for 21st century skills, youth skills, that sort of thing. definitely about inclusion and equity in the digital space, making sure women or people with disabilities have access to these technologies, teacher training and support for refugees, a lot around data privacy and safeguarding data, which you would expect, and also rigorous academic research to see what works. And that research funding is usually kind of for larger institutions and bodies to do that research more than kind of for a Bantwana. And then a little bit for early childhood. But when we talk to our teams in the field, what we really identified, especially since COVID, where we need the funding, is support around developing digital tools for things like gender-based violence support, child protection, case management, as Jill referred to in Zimbabwe, tools to support the training and supervision of social workers, community case workers, and then digital tools for girls' retention, which I'm really surprised we have not found a lot of funding opportunities for, but it's got to be coming. Thank you, Brian, for sharing that. So there is a bit of a disconnect between where these opportunities are and what we want them for. And so what we've been really looking at is the kind of support we need is likely for the time being going to be coming from individual donors, smaller private foundations, or perhaps telecom companies, which are really an important source of funding in this space because they have a lot to gain by everybody getting a phone, right? And using it for work and for everything. And of course, for all of these things, we need intros. So I guess before we pivot over to hearing about a couple pilots that we want to share with you, I'm just wondering if anyone just kind of off the top of their head has any funders in mind that we might just kind of add to our list that we're looking at and that we're researching that might be funding in this space. And it doesn't have to be just for, you know, the things that we had on our list, but just in general, funders working for whether it's digital health, education, savings and loans groups. And you can feel free to send it offline if it's not like on the tip of your tongue. Tom.
Hey, Eliza, I'm not doing service to your question. I'm actually
That's
going to
okay.
ask you for some help.
Yes.
What I'm hearing in your discussion is that there's a pain point, there's a business problem, and the business problem is that the agenda that Bantwana sees isn't being met. Am I right about that? And that may be from the field, which is really important. And my question would be, has anyone done any kind of survey of existing organizations in the world that are meeting that pain point outside of the countries where we work, so as to have a model of what it is we're seeking? I just, you know, technology and ed tech is a big space. I sense that you're asking us to focus on a part of it, and I'm sensing that you're focusing on what I'm going to call the last mile, which is the digitization of the point of contact to a girl, to a child, to a member of the extended beneficiary population that we care about. And I just want to get sharper on what it is you're looking to do with quote ed tech or technology.
Yeah, so I can share with you at some point. We have a database that we put together that lists who are the kind of leaders in the space as we see it. We haven't gone down to like the small NGO level to see what local NGOs are doing. At the moment, that's kind of been outside of the scope because there's like thousands of them. But definitely, if there's certain groups that we can find out from from staff on the ground that they think are doing a good job with it and are doing something related, we can certainly use them as a model and see kind of how are they making it work, where are they getting their funding. That's part of your question. The other part?
Yeah, I'm trying to sharpen the business problem so that I can then better answer your question, who might fund this?
Yeah.
Because it's feeling too big and amorphous for me to get
So you articulated it well in terms of, I like that, meeting the last mile and the kind of point of contact with extended beneficiary population we care about. So I would say it would be the social workers and people on the ground, right? Is one population. But also, if you're looking at out of school youth, for example, and trying to figure out ways for remote learning, or as we transition from post-COVID, and you're looking at ways to maybe add value to the non-formal education sector. Maybe there's a way we can use technology in that. So that would be more kind of in the educational space. But certainly with these kind of social services and figuring out how can we do training and supervision using some kind of smartphone or not smartphone.
Yeah, so I'm going to shut up after this one because I'm talking too much. But I just what you've said just now makes me think, what are the technology platforms that NGOs that are in a healthcare compliance mode that are trying to track at the individual patient level, did you take your medication? Is that technology built, and is that something that's more extendable into the spaces where you want to work than ed tech, which for me gets me into pedagogical epistemology ideas?
No, Tom, just to jump in there, yes, there are, and there's sort of there are organizations, sort of digital organizations that are using, mobile technology. There's a group called Saled, there's a group called Viamo, there's a group now, there are a bunch of them, and we are in constant communication with them. It's finding the funding. They do this stuff, and they've done it. And if you have a big grant and a large program that can cover their costs, you can certainly include them, and they're good. They really are good. It's like, how do we learn to do some of this stuff ourselves, and how do we build our creds, which is what the EdTech Center is trying to do now. And I think what we need is sort of probably more resources there on the tech side that has really done that research of who is doing what and what are the actual technologies available for the contexts in which we work. And I think our EdTech Center currently is much more focused on, the US and education and adult education here, and our context is very different. So they are playing catch up and really trying to figure out some of where those gaps are.
And sometimes you'll see that we have the technology identified. So for example, Nomi and Ronnie are going to tell us about one tab is another one that we have in our pilots we sent you. It's getting the funding for the missing pieces, the training, the tablets, the airtime. Other times it's actually developing the technology and figuring out, as Jill mentioned, piloting which is the technology that works the best. So Jill's going to talk to us about a COVID vaccine hesitancy pilot that we want to do. We don't have that technology built out yet, but we've identified the problem that the technology could help. So there's a lot of different angles where we see potential for having a donor come in, but again, figuring out which donor and how do we get the intro. Any other comments or questions before we have welcome Ronnie and Nomi?
Go for it, Eliza.
Okay, great. So we've sent you a bunch of pilots yesterday, all in the kind of tech space. And today we're going to have Nomi, who's senior advisor for Malawi, and Ronnie, who's program officer for Malawi, to tell you about a pilot that we're planning where we're hoping that technology can be a game changer for women's savings and loans groups. So we're going to welcome Ronnie and have Brian do the screen share and give her our attention.
Hi, everyone. As Eliza mentioned, my name is Ronnie Suarez, and I am a program officer and work alongside Naomi Rich, Alton Mpungo, and Anthony on our new project on a Patikolo Children First activity in Malawi. And I will be presenting on women's economic resilience post-COVID cutting-edge technology to support community savings groups in Malawi. Go on to the next slide. In Malawi, one of the service support we offer is our community savings group. Saving groups are informal community banks, also known as village savings and loan associations. Members meet regularly to make small contributions to a central fund, and they can request for short-term loans. All interest earned is invested back into the central fund, so in the future, members can borrow higher amounts, and or when the saving cycle ends, every member walks away with a percentage of the interest earned depending on the amount they contributed. In Malawi, Bantwana is supporting 1,600 community savings groups that reach over 32,000 women. This picture is one of our groups meeting in the Falombe district. In the center, as you can see, is the chosen leader, the person that the group trusts to be in charge of the funds. If you can go on to the next slide, please, Brian. So typically, saving groups face a couple of challenges, such as they record hundreds of transactions each month, and these are calculated manually and recorded by hand in paper ledger books. This method can be cumbersome and prone to mistakes, making management of the central fund a little bit more difficult. Our members pay their loans back in time, and they build strong credit history that basically becomes invisible to the traditional bank. Adding to this challenge, we've seen in 2020, we faced a COVID-19 pandemic. We witnessed essential supports such as children care, education, health, and child protection services be interrupted. We watch as women face disproportionate disruption to income and employment, and we've seen increases in gender-based violence. These challenges only worsen the already significant gender gaps in digital access to support services and digital literacy. Although our savings groups were able to continue to meet and practice social distance, the necessary coaching and support, as we all imagined, was not the same. If you can go into the next slide, Brian. Please. Thank you. To close the existing gender gap in access to financial services and digital literacy and ameliorate the effects of COVID-19, we at Bantwana are proposing a 12-month micro-pilot collaboration with Dream Start Labs. Dream Start Labs is a multi-award-winning social impact technology provider that designs innovative mobile solutions to help people in the developing world achieve their dreams of a better life, kind of similar to Bantwana. They've created this amazing app called Dream Save. This award-winning app is a digital banking technology that makes it easy for savings groups to manage financial records, achieve saving goals, build credit history, connect to formal financial services. It helps previously unbanked individuals to save money, access bigger loans, and achieve their financial goals. The app is simple to use, so our group saving members are comfortable in having it as their primary ledger system. We predict that this app will simplify bookkeeping, reduce the amount of meeting time. It will help group members set, track, and achieve their financial goals, and collect accurate and comprehensive data to support their ongoing success. As you can see, this app has many benefits for our savings groups members, such as it builds trust and eliminates errors, it automates calculations, enforces groups policy, makes share outs fast and transparent, and it has a built-in predictive analysis. It runs offline with no internet, which is major since a lot of our groups do run in rural areas. So yes, no requirements for internet. Our members can track their personal financial records 24/7 on any phone. I can go on, but I will keep it right here. In the beginning of Bantwana, one of the reasons why the organization was so successful was because it was ahead of the curve with innovative programming. We were in the head of the curve, although we are not creating the technology. By collaborating with Dream Start Labs, today we have an opportunity to again be ahead of the curve of the next generation of programming, that is information, communication, and technology. We are requesting for $20,000 to $32,000 to roll out this 12-month micro-pilot. This amount would cover the translation costs, data packets, the app's license, training costs, customer experience support, and most importantly, to cover the purchase of smartphones. As previously mentioned, this collaboration will put Bantwana ahead of the curve in the next generation of programming, and it will strategically position us for the next wave of funds while empowering 32,000 plus women in Malawi. My name is Ronnie again, and thank you for your attention.
Great job, Ronnie. Move over Shark Tank. I love the energy that Ronnie brings to really professionalizing this idea. So really great job. So let's open this now for people to ask questions to Ronnie and also Nomi, who's here as well, about this model that she presented. Don't be shy, even if it's just clarification. Fred, you're on mute.
Hi, Ronnie, it's Fred. Hi. Thank you very much for that presentation. That was very clear. Thank you. If I'm a prospective donor and I asked you, okay, how would this help leverage? What kind of new platform would this put you on in terms of reaching more women, getting more loans out, some factors that might be evidence in terms of increasing their incomes and productivity? If I would ask you those kind of questions, how would you answer that? If I said, okay, I'm going to put $20,000 in, but I'm treating this as kind of almost like venture capital, what's the payoff for me?
What's the payout for you? Well, you being a board member of Bantwana, wanting to Bantwana to keep on going for a long time, and we being that we're coming into this technology world, this technology is not yet in Malawi. So we would be introducing it to the Malawi people, to the Malawian woman, and to the savings groups in Malawi. So I think it's beneficial in that way. This money wouldn't be going into as an investment where the money would build or be given directly to the saving group's members. It would be to pilot on this micro pilot and purchase these items in the training and the phones, so we can better manage something that is already working in Malawi, but can have better improvements to it.
Great. I've also just dropped into the chat from the larger one-page write-up that we sent around that you may not have seen yet, some of what the research demonstrates in terms of improvements in loan repayments and savings and transparency and things. It's more technical jargon, but I just dropped that in the chat if it's helpful.
And I think, Ronnie, both you and Nomi have had some conversations with the DreamSave folks. So I don't know if you want to elaborate a little bit about that, either of you.
Well, maybe just to jump in, and again, it's a great question, Fred. I think the idea of this technology is not to replace the savings groups. So we have these community savings groups, they're functioning, they're sustainable. When we set them up, there are certain training costs in terms of training the facilitators. And then after 1 or 2 cycles, these groups can operate fairly independently. But this technology will help the groups to run better, more efficiently. As Ronnie was saying, it helps build that or bridge that digital divide. Women, especially in rural Malawi, tend to have less access to phones and don't see them as a tool for achieving their financial goals. And Ronnie alluded to this in her presentation, the credit history. So all of these thousands of community savings groups are functioning, they're saving, they're making loans. Built into this app, there's a system of tracking your progress, and it gives you stars for rewarding good credit behavior. And actually documenting that is really an opportunity for women to start having some sort of a credit history. And there's the option there of advocating that be recognized more formally. So I think it's there's a lot of potential there. I'm gonna stop there. I don't know if that answers your question, Fred.
Yeah, it does. I think just a comment. I mean, just coming kind of out of this microcredit field, some things. Oftentimes donors are looking to say, okay, if I'm putting some money in here, I'm going to get an increase either in, what in terms of what's this going to do for people on the ground? Am I going to reach more people? Are their income's going to go up? Are they going to get access to more credit? I think that tying it, I think, to getting a documented investment history is a very interesting part of this thing. One of the problems that a lot of microcredit people have is graduating to the next level and getting any formal credit. So I think that to try to bridge that gap is a very important aspect of this thing. I think that's a really good thing, as well as. So have you tested this? Is this a test, so to speak, or this technology? This app has been tested, so. This would not so much be a test; it would be applying it to these groups to improve their functioning and their efficiency and their right. This is not
exactly bringing it to Malawi for the first time. And as Jill was saying earlier, we're building our creds in terms of digital technology, and I think that that's something very important for Bantwana when we talk about our work with community savings groups, to be able to show that we are partnering with. Partners that have developed and are using cutting edge technology. There's also a whole analytics to this app. I think that would really allow us to generate a lot more insights from our savings groups. So again, there's a lot of potential for Bantwana to leverage this.
And these women already have phones. These women already have phones, or they need phones.
So both. The leader of the group needs a smartphone. It requires a smartphone for the leader of the group, and we would be providing that for the leaders. It's mixed in the groups. If women have their own phone, no matter what kind of a phone, they can access some level of information. With a password, they could also use somebody else's phone to get information on their particular, like it would replace their paper passbook. So they would be able to get information. And one of the things that's also very powerful that I think they're just starting to document is that there's a predictive algorithm to it. So you're saving a certain amount every week. You don't really know what that's going to look like at the end. And so this app with a little visual graphic shows you, if you continue saving, what do you anticipate your share out to be? If you increase your saving, you know, and you, instead of buying 1 share every week, you buy 3 shares, what will your save out, your payout at the end be? So that predictive feature, I think, is another added benefit. And so women can access that by looking at the phone of the group leader, and they can also get information on their own phones. Participating in the savings group, having that share out at the end, we think would also encourage them to buy their own phones. So it's not so much that we're trying to buy phones for everyone, but leverage these savings groups. And again, kind of encourage the women to get their own phones, the members.
A very, very interesting project. Can you send me any of the stuff you got on that? If there's a write-up of that, that would be really interesting.
And I think, Fred, from what Naomi has told me, that they are, so DreamSave is now being tested or rolled out in 15 countries. They haven't tried it in Malawi yet. So it would be interesting to get some of the analytics, you know, how using this, how's it really impacted women's savings?
Yeah.
How's it impacted the groups? What has worked better since they've been, you know, using it?
Yeah.
Are they being connected to mobile banking? So, you know, are they crossing that digital divide more and having access to real services from a bank, which they couldn't get to physically, especially under COVID before? I mean, those are some of the questions I'd be interested to know more about.
Yeah, it's a really interesting. Very interesting.
And the business aspect as well, those 15 countries where they're rolling it out, they are not a service delivery. They are a financial tech social enterprise. So they are partnering with the CARES, the CRSs, the Plan Internationals. Malawi was on their radar as a market that they would like to go into, and we approached them early and have been negotiating with them. And they said, well, we got them interested in Bantwana, and so they're willing to go into Malawi now with us. So we really see that as an opportunity. Again, it puts us in a very favorable position in Malawi. And again, it's about those partnerships with the technology partners to keep us at that cutting edge.
Not to get too far into the weeds, and I'll shut up after this. But how does the group leader handle the cash that she's given? How does she safeguard that cash for the members?
That's a really good question. And when I started working with savings groups, it took me a while to understand how that works. So every week the cash is collected. Every week loans are made. So if you have a well-functioning savings group, there's very little money that is sitting in the box. This app doesn't replace the physical box where the money is stored. It just replaces the ledger. So the money is coming in, it's immediately loaned out. So part of the functioning of the group, right? Everyone saves, those savings are recorded, loans are repaid, and new loans are made. And there's an interest rate. So that capital is always growing. And at the end of the cycle, everything is distributed and you start again.
I think Fred's dog took over there for a sec.
Sorry, I just had, my dog was giving me trouble here. Okay, all right.
Anne, did you have a question?
I was just going to make a quick comment. I mean, it actually sounds really exciting. I think mobile money is starting to take off in Malawi, isn't it?
Starting to, yes.
Yeah. So if I think about segment of the customer base, and actually firstly group schemes, my understanding is group schemes work quite well. So actually everybody having access and seeing has got a wonderful effect of encouraging for want of a better word, compliance, and then allowing everybody to graduate as well as the group to graduate. With the potential link to mobile money, Fred, that might start to address the challenge of the box at some point, yeah.
Yeah. And again, I don't know how many of our members have phones, but of the 32,000 women who are members, we know that about 7,300 of them have mobile money accounts. So there might be more that have phones and don't have the mobile money accounts. We were just tracking how many are actually already using mobile money. So there's definitely room for expansion there. And these are primarily in women in rural or peri-urban settings. So it's very
It would just be
encouraging.
very cool to try it out and see.
Can I, I'd
yeah.
love to just say a couple of things. Ronnie, first of all, I thought that was an awesome presentation. So thank you for that. It was just awesome. And I want to put you back on the spot with a question to you. As you think about the local banking system in Malawi, and as you think about an aspiration to help women build credit history, is there an intersection to get funding from a local banking franchise? I don't know if Standard Bank has operations there, or if you know of other satellite, affiliates that would be potentially interested in building a partnership here.
We should ask Anne that question too, if she knows if banks do that kind
No,
of thing.
I'm doing just that, Jill. Thanks.
Right. Okay. So yes, we do have operations in Malawi. I don't think we bank that segment of the population. I know a little bit about it because we've got a project running elsewhere in the group that I'm involved in to some extent. But I think in Malawi, it's Airtel that's doing the mobile monies. So I think there will be quite a few other providers where actually access to this data of green, say, allows your ladies groups, the women's groups, to become a cohort and start growing their banking activity off that, both as a group and potentially as individuals. Because Malawi's got quite a nice culture of investing in schemes. I mean, sort of anecdotally, it's a fairly low income country, but it's one of the countries where we find people invest in the stock exchange and not in land. Whereas everywhere else we work, everybody buys some land and builds a house over a period of time. So the savings culture historically in Malawi looks a little different from some of the other countries. So I'd expect it to accelerate quite a bit there. Apart from the fact that probably encourage some economic activity. I'm sure these ladies have economic activity. So we find typically that the economically active poor, I'm sure there's a better term for that, make the best use of this.
And because I think it'd be awesome if some collaboration existed with the local banking franchises. That just speaks miles to the future of not just this initiative, but things beyond that. The second thought is that DreamWorks, they must have, from working with these other organizations, a body of relationship capital that just to sell into the quote financial inclusion marketplace, which the consolidation of banking around the world is self-evident. So there's that, and then flipping it on its head. Google has a lot of work going on in financial inclusion. If you're using Android technology, then they're obviously going to speak with each other. And I don't know, Eliza, anybody at Google to sort of pitch right now, but that has to be something that's mappable. And that would be the mother lode that I can think of here in the United States for this kind of funding.
Yeah, thank you. Yeah, Google. And then, we've been researching some of the telecoms. And again, like there's certain telecoms in certain countries and they don't all have the same CSR programming. But maybe, Anne, you might be best suited to kind of have, I don't know, any info on that or be one or two steps removed. But we're trying to figure out, is there a way we can get any either phone donations from telecoms or airtime donations from telecoms? And otherwise, also just looking at foundations who might be willing to fund this pilot or individuals.
I'll send you an email separately. They've all got different foundations with a different approach. And I'll probably guide you of how to approach them so I can avoid a conflict issue.
Yes, what I could do is I could send you my spreadsheet that lists all the telecoms, by country. And if you have any thoughts on whether you have any contacts or just additional thoughts, just to save you from having to.
I could probably very quickly get the contacts for each individual country and let you know who's running the foundation, what their CSR activity is as a start. Yeah. Okay.
Thanks a lot. Any other comments on this pilot before Jill tells you briefly about another, a second pilot, which will be a shorter conversation, but any other final comments or thoughts or questions? Okay, great. Thanks. That was great. Thank you so much, Naomi and Ronnie. You're welcome to stay for the next pilot if you want, but I know you're both busy. So if you need to move on to your next thing, feel free to be excused, and we'll definitely
you.
follow up.
Thank you for
after this.
listening, guys. Thank you.
Yeah, thank you, everyone.
Yeah, no, that was great, you guys.
Excellent,
It's
excellent.
really exciting. Thank you. And thanks, Ronnie, for putting the prep and thought into it. It's really appreciated. It was great. So the next one is not quite as techy, but it's very needed right now. And we've just been talking a lot about, we're seeing in all of our countries a lot of vaccine hesitancy on the ground in communities where we work. And, as vaccines start to be rolled out, they're still being rolled out very slowly in all the countries where we work for a variety of reasons. India stopped exporting the vaccine for now. People are distrustful of some of the Chinese vaccines that are out there. They are also just distrustful of vaccines, period. A lot of our, country directors have been able to access the vaccine and been vaccinated, but they are finding it difficult to persuade even a lot of our staff, not to mention our community members, that this is the way to go. So one of the things we've been talking a little bit about is, piloting a community mobilization effort, first to identify, what the barriers are to the uptake of vaccine, and then to develop appropriate messaging and also, train CCWs who are out in the community, our case care workers, and who are working with families in the community, how to message appropriately around vaccine uptake. And then we'd also work closely with local clinical partners and with government on the supply side. So we're thinking how we could integrate this pilot into our current case management work, because we're out there in the field, in these communities, and across our portfolio, and we choose an appropriate project to sort of see where it makes best sense and where some of the highest hesitancy rates are, and we could test this model. So that's another thing we are looking to try and do, really sort of at the grassroots level.
And this is obviously something that we want to do as soon as possible, right? As we try and get more people to buy into having a vaccine. And obviously we have to work with supply chain on that, but this is obviously one that we don't have tons of time to wait 8 months to see if we can find a donor for. So we welcome any thoughts you guys have on this.
So if I may jump in,
Yeah.
So one of the things that I heard last week through our Yemen health team lead at USAID was that there's going to be 3 tranches of funding for vaccine technical assistance, and vaccine hesitancy is a big component of that in terms of what they are going to fund. And there's $350 million in that first tranche. So I can find out more to sort of see how Bantwana can access that, but your contacts would probably be in a position as well to provide some guidance. Yemen has been prioritized, which is why we heard about it, but there are many other countries as well across the globe. So I think it's a matter of jumping in on this sooner rather than later.
Exactly. No.
That
would be great if you could just get us even some of the basics. And we'll also talk to our missions, but we were also trying to think, how do we get ahead of it? Because if we are saying, listen, we've piloted this, we're the guys you need to go to help you figure this out. So,
and it's hard because if there's 100 million, or I can't remember the number you said, and we're just looking for 20,000, right? Or 20,000 to try a pilot idea. It's kind of like a mismatch there. But as Jill said, that's the funding we want after we pilot the idea.
Absolutely. And, we can get lost in these numbers. It's 350 million in that first, but, if it's across the globe, so it's many countries. So when it boils down to a particular country, it's not that many.
Much less.
So getting ahead of this is very important. Yeah.
And I'm sure that's also, as you say, 3 tranches. It will be for distribution and probably for some of the physical infrastructure and heaven knows what. So there'll be one.
Jing, did you want to add something?
Jing saying she has a contact too. Thank you.
Did you want to add something, Jing?
Yes. So I just thought about a friend of my husband, so they provided the test tool for the COVID. So I'm just thinking they may have contacts about the vaccines, but I'm not sure. I need to check. So
Great.
I will.
Yeah,
Yeah, I
we
can
can also-
update later.
We can write up a little paragraph too to send to you if you wanted to be able to forward something to them with what we're requesting,
Yeah.
just in case they're interested.
Yeah.
Thank
Yeah.
you.
Yeah. I just need to check.
Thanks.
Thanks, Jing.
Mhm.
Good. I think,
Hey, Jill and Eliza, the only other thought that comes into my head around vaccines and getting local partners, and I respect that this is just an idea with no basis, is any corporations that are in the cold storage chain are going to be really important partners.
Yes.
So pilot of X versus national strategy of a million X. Just again, if there was a way for local colleagues to develop
check that out.
relationships with the corporate
Mhm.
side, that would be the cold storage chain would be the obvious one to me.
Yeah, no, that's a good idea also.
That's why it's
John.
great to have this board, because I know that would have never popped into my mind as I've been doing my research.
No,
The cold
exactly. I think
storage chain line wasn't on my list. So that's great to have all of your minds, with these ideas you're generating.
And do speak to Vanessa Richard, who
Okay.
is part of the immunization center, who works on cold chain. And
Yes, good idea. Okay, good ideas. Thank you, guys.
Anybody else have anything about this or anything you didn't get to say previously? We're
I
doing
saw
well.
Joel had to drop off, Tanya had to drop off, but I think we've covered everything we
Yes.
planned to, Eliza.
Oh, Fred, you had one thing? You're on mute though.
I just noticed on the Go Girls Connect, is that something that you're trying to raise some funds for as well?
Yeah,
that-
so this is something, Fred, Go Girls Connect, we developed when we were doing, when we had some dreams funding in Eswatini, actually. And
Right.
it's something we'd really like to replicate because it was really successful. And we had some money from the Open Society Foundation as well as from USAID, but it was Open Societies, was Open Society South Africa, OSISA, were really all over this. They liked the idea because they were working in the gender-based violence space, and then also looking at the use of technology. And then COVID hit and they cut our funding because they were putting all of their funding into COVID. So we had to stop the program, and that was a bummer. So we would really like to build out that. We think it's got a lot of potential.
Yeah. So this is kind of restarting it.
Exactly.
And you're promoting this through the existing networks that you already have in Eswatini, right?
Exactly. And we have all of the, we worked with CellEd, we have the whole mobile, we've built out the survey, we have the digital technology sorted, we've tested it with the girls, we've piloted it. It was going well. And we'd been, I think we were about like a year into a 3-year project, and then they cut the funding.
Because I'm just thinking, we've been thinking about having maybe like a get together for Bantwana in Washington.
Mm-hmm.
These kind of themes are really good. I just think that the vulnerability, especially, post AIDS, post HIV, post COVID, the vulnerability and the direct intervention and empowerment is really, I just think, that's an important thing for kind of rolling out just the image of Bantwana, especially in Washington, we were talking about that. So we need to work on that. And this is a really good.
Well, let's make a note of that, Fred, because soon we'll be able to have an in-person gathering.
That's what I'm saying, right? Exactly.
So
and
it'd be great.
Again, getting ahead of the curve, because a lot of people are going to start rolling stuff out. So I think the sooner the better to just, it's an informal thing of 20 people that we know are kind of well networked, and I can help put that together here, and it'd be good.
And how do we show that we're ahead of the curve and that they support our ahead of the curve-ness?
Exactly. Bingo. Exactly. That's a good one.
So you mentioned that we only are looking for $20,000. Are we have we tried crowdsourcing any of these, sort of smaller initiatives?
I mean, because these smaller things come, if we had to do them from scratch, of course, they'd be hugely expensive, but we'd integrate them into our current funded projects. So, which is why we can do them, pilot them for not that much money. No, we haven't tried crowdsourcing them. We've never tried crowdsourcing.
We haven't done any crowdfunding type of platform, but the only platform we did join was Hasana, which is a platform for Muslims around the world to give. And they're just beta testing it now, so we haven't actually gotten money yet, but they actually sent around a message recently. We didn't get asked, but US division did, if they had like COVID special project they wanted to put on, and I had just kind of left it because we hadn't made any money yet. I thought, let's not bother, but I could write back to them, or I could check and see the others who are on the platform if they got any funding for that. Because I know with Ramadan and then Eid, they have special asks. And so it is it's like a global giving, but for the Muslim world. So it's in effect, would have kind of a similar thing. Otherwise, if we were to do a regular crowdfunding thing, does anyone know the best platforms? I'm just trying to think about like fees and all of that, like Indiegogo. Tom, I feel like you would know this.
It's funny. I wished I did, and I am directionally 110% in support of a digital crowdfunding strategy for a $20,000 project, because I think we'd learn a ton. And I would even go so far to answer your question, Eliza. You mentioned Indiegogo. There's probably 3 that I could, if I really worked hard, could name, and there are probably 30 more that are out there.
Yeah.
So my sense would be for $20,000, just go on Indiegogo, see what happens.
Right. Yeah.
And then I'd get in touch with my 20 to 40-year-old friends and see
43, 20 to 43, please.
Excuse me. I thought I was going to nail it. Well, there. See, I just missed it by a tick. And have have the right 10. But the cost of entry has to be pretty low, and I would say go shop around for a good GoFundMe platform.
Carlina, this is up your alley.
Yeah, this is a little bit up my alley. I've done a number of crowdsourcing campaigns for films I've worked on.
Okay.
So while I don't have the costs and everything on the tip of my tongue, I know a lot of people who do, and I could easily get educated if you're looking for people to start.
Oh, thank you.
At that. I know we're ending our time, so I won't blather on and on about that, but if you want any support in that, that's something I do have experience
in. Maybe you and I could have just a phone call offline with camera, so we could have like a visit, and we could just do that, because I do think, given the vaccine hesitancy in the United States, there's enough people who feel strongly about wanting to address it even here, that I think that would be something that would speak to people, this kind of project, even if they're putting in $5, but if that kind of spread.
Absolutely. There's a lot of exciting things I've been hearing about the tech center and everything. Don't worry, you'll be getting follow-up.
Oh, I'm excited. Maybe even
I haven't been chiming in, but that's I'm mulling. So thank you. I just wanted to throw that in there.
That would be great, Carlina. Thank you.
Pleasure.
Good. Well, I think this is a great meeting. Thank you guys all for your input and insight. As always, it's just really useful and helps us think kind of in new angles.
Just nice to see everybody, nice to get everybody's ideas. It's always invigorating, I have to say. We spend so much time putting out fires. It's really nice to think a bit. So it's been great.
Jing, really nice to meet you. Bye. Thank you.
Yeah.
Thank you, everybody.
To meet you guys.
Thank you,
Bye.
Jing.
Thank you.
Nice to
Thank
see
you, everybody.
Great to see you, Fred.
Bye, everybody.
Cheers, Kum.
Next time in person.
Yeah.
Yay.
Yeah.